I don't understand the thinking from how I got taught that. How would you like? What are you going to do if you don't use manual therapy? With how are you going to fix those hypomobile joints that have lost range of motion, that are stuck, that are not functioning well? You sprain an ankle, you tear a ligament, you then have assumed instability at that joint. So the first question the students ask is, why on earth would I want to mobilize an ankle when they've already got too much movement? That's the problem. We want to stiffen it and reduce the movement. And it's a really great question. So it happens every year. And so really welcome it. And what we need to do is understand what's happened at the site of that pathology, and then really use our hands to assess what has happened. In reality, what we often see is there might be some subtle instability in that anterolateral corner of the ankle, and if it's a full tear, then the patient will compensate for that typically. And the way they do that is they stiffen. So now we have a scenario where our available range that allows us to adjust to the surface, to make adjustments in movement, has been actually reduced. So whilst we might have more movement at the anterolateral corner of the ankle, we've got less movement everywhere else. And when you stand on something that is unable to adjust then and adapt, then you feel unstable, because the slightest shift in center of mass or gravity takes you closer to the edge of what you can control. And so that patient will feel very unstable. And we then make the assumption that it's the anterolateral corner, that if you test it and strain it, may have a degree more movement than it did pre-injury. And we assume that that's what's driving it. And I don't think that's the case. So what would I do with that patient? I would mobilize, well, I'd check their talus, and then immediate changes in the patient are mind blowing. This happens real time if you're skilled enough, and they will feel more stable. Their static balance goes up, their dynamic balance goes up immediately on good testing, and this is reproducible, and you'll help that patient get back much faster.